started. Good morning, everyone. Thank you, or almost afternoon. Thank you for joining us for our next session in our 2021 Virtual Benefits Fair. We are thrilled that you could join us for this session. I am Kimberly Williams. I'm the Assistant Town Manager, and today I'm joined by Jessica Rojas, who is my co-host for today's fair. Also, our another member of our HR department is Tracy Lavoy, who is our payroll and benefits specialist, is on the call as well. I'd like to remind everyone that today's session is being recorded so that any information that you miss during the presentation, you will be able to view this later, and we encourage you to do so. Our presenter today is Liz Jenny from Harvard Pilgrim Healthcare, a longtime vendor for the town of Bridgewater. She is going to be making a presentation and allowing you to ask your questions. So with that, I will get out of the way and turn the session over to you, Liz.
Thank you, Kim. Hi, everybody, and welcome to your second virtual benefit fair for Mayflower. And I certainly hope that, I think we all hope that next year we can all be in person for this. So going to give some brief overview on your benefits and some time to ask questions. So let's see. I'm not sure. Just having some issues. There we go. Okay. So you may have heard Harvard Pilgrim and Tufts are combining. This is not going to affect your benefits at all this year. You may or may not have heard this, but we are combining our companies to improve affordability, improve quality of health, and member access will be much different once these two organizations are together. So we're very excited about that, and just wanted to mention that if that's something that you had not heard. So during the pandemic, there are a number of ways that Harvard Pilgrim has supported our members. We have a Living Well at Home program with different virtual classes that both members and non-members can take advantage of. You can check this out on Harvard Pilgrim's website at the address you see here. If you go to our home page, there will be several links to direct you to these programs. And I would encourage you to take advantage of those. Even now, we're a year into this pandemic, there are a number of helpful classes that might help you with any stress-related situations that you're feeling, going through, well-being webinars and things like that. So just to touch on a network overview with Harvard Pilgrim in terms of the plan design, your ability to access providers, among many other things. This slide gives you a nice visual of where Harvard Pilgrim is. We're a regional carrier with a national reputation for excellence, with more than 85,000 doctors and other clinicians and 182 hospitals across Harvard Pilgrim's network. You have access to primary care doctors, specialists. If you are choosing a primary care for the first time, you can do that in a couple of ways. If you're changing, you can do that online. You can also do that by calling member services. When you have an HMO plan, you do have to select a primary care doctor from our network. Referrals are required for most specialist care. Most people now are used to getting referrals, and they are pretty much done behind the scene now electronically and come right through to Harvard Pilgrim. So shouldn't be any headache on your part in terms of having to collect that piece of paper you might have done many years ago. You just simply contact your primary care and they would put in a referral for your medically necessary visit or anything that you have with a specialist, especially ongoing care that's important to stay with. Emergency services are covered worldwide, so that's something that you want to remember, that no matter where you travel, you're covered for anything that is urgent, unforeseen, or in an emergency situation. So Harvard Pilgrim partners with Optum for behavioral health. This is an important area of health for everybody, and it is a large network, really spanning across the country. confidential, accessible support, and different treatment options. And you can also access virtual visits, which right now, many people are taking advantage of. So on Harvard Pilgrim's website, we have a dedicated page that talks about behavioral health. There are a number of different programs that we partner with that have apps if you have a smartphone, or you can also use an Android phone with different capabilities on those phones. Sanvello mobile app is available. It's a new partnership with Harvard Pilgrim, or fairly new, I should say, as well as a number of other behavioral health conditions you can access, talking about when is it the right time to seek help, choosing a behavioral health provider. So if you're looking for a counselor or a therapist for the first time, you can go to Harvard Pilgrim's website here and access behavioral health information. So the next few slides touch on the Mayflower Municipal Health Group plan options for 2021, or plan option. There are a number of plans that are offered to all of the groups that are part of the Mayflower group. We're going to touch on the benchmark HMO, which is the plan design that is available to Mayflower, the town of Bridgewater employees. So we'll touch on that. We'll also talk about some additional programs that are available to you. Telemedicine with our partnership with Doctor on Demand. Many people have utilized Doctor on Demand throughout the pandemic and even outside of that, but more so in the last year for both behavioral health as well as urgent care visits. So we'll take a look at that as well. We'll talk about your fitness benefits, some weight loss reimbursement program, which is great to take advantage of, and then our well-being portal. So this slide touches on the benefit summary. You can focus really just on this benchmark. So if you look 3 columns over, you'll see the HMO benchmark, which is the plan available to the town of Bridgewater. If you look, you will see that you have a plan year deductible of $300 for an individual and $900 per family. Your maximum out of pocket is $2,000, $4,000 for medical. This number is designed to protect you should you have a really tough year, maybe where you're seeking extra medical appointments, help for certain conditions. If you happen to have kind of that tough year where you might be seeing a doctor more often, once you reach this number, Harvard Pilgrim steps in, which is really, your reason to have health insurance, to have protection in that regard. The preventive care is covered at 100%. This has not changed. So your annual physical, make sure to take advantage of that. Your office visit copays are $20 and $60. So 20 would be for your level 1 copay, which would be primary care. Your $60 copay would be for any specialist visit. So if you have to see a cardiologist, if you have to see an endocrinologist, neurology, anything that falls into specialty would fall into that tier 2 copay. Routine eye exam is covered. That's covered in full every 2 years, every 24 months. Emergency care is subject to that deductible first, then you have a $100 copay. Both acupuncture and chiropractic care is part of your benefit package. This is a terrific benefit many people take advantage of. For acupuncture, you have 12 visits at a $20 copay, and for chiro, you have 20 visits per plan year at a $20 copay. PT and OT, so if you need physical therapy, occupational therapy, that is covered, 60 visits per plan year, and that is a $20 copay. If you have to go into the hospital, there are tiers. So tier 1, tier 2, and tier 3. You can access these tiers and providers online at our provider directory. If you're in the hospital for tier 1 or tier 2, you pay a $500 copay after you reach your deductible. If you are in a tier 3 hospital, you would have a $1,500 copay after your deductible. Outpatient day surgery is the same regardless of where you are, and it's deductible first, then a $250 copay. Any diagnostic lab work that you have to have done is first subject to that deductible, then it's covered in full. MRIs, CAT scans, any kind of advanced radiology, sort of higher cost or high-end radiology, first would meet your deductible, then you would have a $100 copay. Prescription drugs are covered. The copays are $10, $30, and $65. That's for a 30-day supply. If you're on a regular maintenance medication, I would encourage you to take a look at the mail order program that we offer. You do save a bit of money, as you can see here. So for a tier 1 prescription for a 90-day supply, you would pay a $25 copay as opposed to a $30 copay. So it doesn't sound like a whole lot per month, but it does add up over the course of a year. So take a look at that. If you're on anything regularly, let's say for blood pressure, cholesterol, birth control, anything that you take regularly, you can certainly save with that mail order program. That's kind of a brief overview on your core benefits per se. There is a lot of additional detail, like I said, on the website. And I'll just kind of advance to the next slide and we'll talk a little bit about network. So if you are looking for a doctor on this benchmark plan, you go to Harvard Pilgrim's website, as you can see here, click on Find a Provider, choose HMO, and then you would want to choose the tiered plans that you see here, or tiered limited plans. That would give you access to the ChoiceNet benchmark program, as Mayflower refers to that. So you can access doctors, hospitals, and see exactly which tier they fall in. Let's talk a little bit about your pharmacy benefit. So as of 2021, Harvard Pilgrim will be covering certain over-the-counter medications for common conditions like cold, allergy, dermatology. They'll be covered on tier 1. You do have to get a prescription from your primary care, and tier 1 cost share will apply. So there are some things, for example, like a brand name Zyrtec for allergies, for example, that can be pretty costly. So you may find that this benefit does work well for you if you are on something that you normally would purchase over the counter that would now fall into that tier 1 copay, which would save you some money. So that is a new program as of 2021. If you're looking for a prescription, or let's say you want to see where a particular prescription will fall, the town of Bridgewater has the premium 3-tier prescription plan. This should be on your card, and you can access it on Harvard Pilgrim's website under pharmacy. Make sure that you select premium 3-tier, and then it will give you an area where you can do a search for your prescription drugs. Let me just go back to that real quick. So you would choose the premium 3-tier, and then you would end up plugging in the name of the drug. You can look up a drug a couple of different ways under conditions. You can also look it up and just type in the prescription drug, select what type or what milligram or what dosage that you're on, and it would give you the copay that you would pay for that. So let's talk a little bit about, beyond your core benefits, the Harvard Pilgrim member experience. So Harvard Pilgrim you have the ability as a member to access your Harvard Pilgrim benefits through our mobile app, or you can go through harvardpilgrim.org. Apple Wallet compatible Android users, you can save it as a PDF. It updates in real time. So let's say you're kind of curious where you fall in terms of your deductible. You can access this information right on the Harvard Pilgrim app. There have been some improvements made. So I would encourage you, if you happen to do a lot of your things online or with your phone or with a tablet, to take a look at that. This way you don't have to access it via your computer or laptop. Just going to pause for a minute. I'm not sure if I've got, let's see. Okay, just checking the chat. Great. So in terms of establishing an account, so Harvard Pilgrim, as I had mentioned earlier, has quite a bit of information and resources on our website. You would need to pick a username and a password, just like you would for anything, to log in and to have a secure account on harvardpilgrim.org. You can get quick, reliable answers to any questions. You can look up benefits, claims. Let's say you happen to be going to a visit that is subject to your deductible, and you want to see if that bill has been sent out and if Harvard Pilgrim has applied our discount. You can access that information as well. You can also take advantage of discounts and savings, apply for your fitness reimbursement, and a number of things. So I'd encourage you, if you haven't done that yet, to access harvardpilgrim.org and set that account up for yourself. Let's see here. Whoop, there we go. So this is an estimate a treatment or service tool. So this is important to go onto Harvard Pilgrim site. Whoops, excuse me, advancing here. A simple way to estimate. So let's say you have a procedure coming up and you want to estimate what that might cost you. You can plan ahead for out-of-pocket costs. You can find any cost estimate for a treatment or service in your geographic area. So this estimate my cost tool is widely used by a lot of members, and I would encourage you to take a look at that if you have something coming up like an MRI, and you can find possibly a lower cost MRI that you are getting done in the near future, or even down the road if that's something that your doctor might be ordering for you. So you'll receive an activity summary. You will get that, and you can certainly access it online as well. Pretty much highlights how your claim was processed. So you might remember or recall getting something like this. At the top, it will say this is not a bill. It'll tell you that we received a bill from your provider. What part of that has been adjusted, so to speak. You have health insurance, so we would discount the visit based on the contract with the provider. And it will tell you exactly what you're responsible for. Let's say you have a deductible that has to be met first. If it went towards your deductible, the activity summary will tell you that as well. It helps you kind of keep track of things. I always tell people when you get this in the mail, and let's say you haven't received a bill from your provider, put this somewhere important, maybe keep a folder or a bin in your kitchen or wherever you keep important papers. Keep it there, and then when you get your bill in the mail from the provider, make sure you compare them and you match those up to each other so that you know that what the provider says that you owe is what you do in fact owe. So that's really important to pay attention to that. Urgent care is covered in a number of ways. This slide is really designed to remind folks that there are a number of ways that you can access urgent care if you are sick, if you have a child that's sick. You can access telemedicine through Doctor on Demand. You can also access telemedicine with many pediatricians and internal medicine family practice doctors now, with their own individual practices. You can go to a CVS Minute Clinic. You can go to an urgent care clinic, or you could go to the emergency room. Your typical out-of-pocket costs are going to be much lower, starting with telemedicine, which really would be the same copay as your primary care cost sharing. So that tier 1 copay we talked about, with your highest cost being in the emergency room. Obviously, this is something you absolutely need to use your judgment on. If you believe that you need to be in the emergency room and you're having an emergency, please do not hesitate and go right to the emergency room. So we touched a little bit on the well-being programs that Harvard Pilgrim offers. Once you're online, you can connect with others and develop a personalized well-being plan for yourself. You can also connect with a lifestyle management coach. The digital platform is accessible from all devices. So whether you have a tablet, a phone, a computer, laptop, lots of information on mindfulness and meditation. So take a look on the website under well-being and wellness. You will see a link to that. And there are quite a few programs that many folks are looking into and possibly haven't heard of before. So that's an important thing I just wanted to share. We have a couple of partnerships with women's health initiatives supporting and empowering our members. Ovia Health offering support to members navigating fertility, pregnancy, early parenting, as well as Progeny Health, which is medical management to improve health outcomes for babies who have to be in the NICU. Again, more information on Harvard Pilgrim's site on those programs. Terrific benefits for members. We offer numerous benefits. A couple of the most, really, I guess the popular programs would be the fitness reimbursement as well as the eyewear discounts. So take advantage of those. There's also a free eyewear program if you get your eye exam done at Vision Work. So there's quite a few listed here, and you can take a look on Harvard Pilgrim's site to access even more. The fitness reimbursement, you do have to submit for that. Online is the quickest way to do that. We provide reimbursement up to $300 per Harvard Pilgrim member, and that is a calendar year benefit. It also includes virtual classes now, so that is exciting for those folks who are reluctant possibly to return to a gym. You can absolutely submit for virtual fitness classes. More about living well being classes at no cost, available at harvardpilgrim.org/living well at home. As you can see here, yoga, Zumba, Mondays and Wednesdays for yoga, and Tuesdays and Thursdays for Zumba. We have some of these classes, we have had well over 200 people at these sessions during the pandemic. So I'd encourage you to take a look at those. And we're here for you. So you can contact Harvard Pilgrim Member Services by phone. This phone number is on your card. You can also send an email to Member Services and get responses quickly online. You can send an online email at any hour of the day and then wait to hear back from a Member Service representative. So that's kind of what I have in terms of an overview. I know we're trying to stay within the time allowed, so hope I left a little time.
Yeah, I think you have.
Thank you.
Thank you so much, Liz. We have time for 1 or 2 questions, so I'd like to open it up. If you have a question, please ask the expert and unmute yourself, or you can put your question in the chat. Just go through any questions.
Hi there, I actually have a question.
Go ahead. Is that Ryan?
Yes, well, his
Okay.
fiance.
Okay, please.
Okay. We're trying to search for providers within network, and we're on the website, but it's not really indicating whether or not they're within network. And I just was wondering if there's an easier way to go about it.
Right. So if you are on Harvard Pilgrim's site and you click on, I don't know how far you got, but when you select HMO, it'll give you options for the tiered network. You should see, it should say tiered. Did you click on that?
I clicked HMO and I was just searching the facility.
Right. So you have to select the plan you have, which is called ChoiceNet. Once you click HMO, you should, and you don't have to be logged in to do this. You can just access the website that way. I'm just wondering if there's, I could certainly follow up with you online to kind of help you through that in the interest of time. I'm not sure, I could certainly pull it up now for you. And you select ChoiceNet, which is limited, it'll say tiered network. And then you'll see another drop down and it will give you ChoiceNet as an option. That is the plan design that you'll want to select. Once you select the actual plan that you have, then you would just type in a name, or let's say you want to go to a particular hospital, you would plug in the name and it would show you what tier.
Okay, we found it.
Did you find it?
Yes, thank you.
Okay, great. Happy to follow up. If you run into any issues searching, please reach out to Jessica or Kim, and I'm happy to follow up with you.
Okay, great. Thank you.
You're welcome.
Excellent. We have time for just one more question. Anyone? Great. I don't see any in the chat, but I would like to thank you, Liz, for joining us today and encourage everyone to, this presentation will be again on our website, so you can view it again. And if you have questions, as Liz has shown you, please do call the phone number on the website. This information we will send out to you also later today. We want to remind everyone that this is our open enrollment period has started today, and it will run through Friday, May 14th. I think I got that right. Jessica,
yes,
Friday,
May 14th. Yep, that is
great.
Correct.
Okay, and this is the only time that you can make voluntary changes to your benefits. So we want to make sure that you get your questions asked and answered during this period and make changes if you need to do so. I'd like to thank everyone for joining us today, our employees and families and retirees. Thank you again, Liz, for joining us, and encourage you to join us for the rest of our sessions of our virtual fair. So
thanks for having us.
Thank you so much. I hope everyone has a great rest of your day.
Thank you. You too.
Thank you.